little bit about your journey? Like, when did it start? When were you diagnosed?
I was diagnosed back in 2012.
Okay.
Dr. Rosbert Phillips is my surgeon. And, you know, they asked me to retake my mammogram, and when I retook the mammogram, I wasn't thinking there was something gonna still be there, because I wasn't even 50. I was in my early 40s. And so I didn't think that I could get breast cancer. I knew it was possible, but I didn't think that, you know, I would be chosen. And so when I got that news from Dr. Phillips, it changed my life. And while I didn't want to tell people, you know, I learned from that because my mother told everybody. And when I told her mom, you know, you loose on the lips. You're not, you know, I don't want anybody to know. She said, baby, you have to get the prayer warriors on the cancer. That's how you get rid of and keep cancer out. You got to get the prayer warriors. She said, you can't be quiet. You got to tell everybody your story. I said, well, I don't want people to know. She said, well, honey, you're going to have to get over that because people need to know. She said, you're going to save other people's lives. Well, I wasn't hearing that in the early stages, but I went through the surgery and I went through some treatment, and maybe 4 or 5 years later, I began to talk about it. But right after the same year I I was diagnosed, I worked with State Rep Pam Dickerson. I was her campaign manager at the time and advisor. And I told her, I said, I've been doing a lot of research on breast cancer, being at home recovering. I found out that so many women are going, they're not being diagnosed early enough to save their lives. And because they're underserved, they don't have access to health care. And a lot of times it's ignorance, it's fear, and especially in the Black community, you know. And so Dr. Phillips, I started getting involved with her foundation, Sisters by Choice, and working side by side with her. And I realized women just don't know. But what really got me is the fact that African American women are least diagnosed compared to white Caucasian women, but more of us die from breast cancer than they do. And that's an indication that we're not getting the services that we need to diagnose this disease early so that we can win the fight. And so I asked Pam Dickerson, I said, I want you to do an initiative in the community, a women wellness initiative. And so she said, let's do it. And I asked my surgeon, Dr. Phillips, to provide free exams. And at the time, Helping Hands had vouchers for free breast exams. And I'll never forget us asking them, and they came right through for us. Dr. Phillips came in, Helping Hands brought the exam table, and Dr. Robertson and Dr. Phillips came and examined these women on a Saturday at Salem High School. That birthed our first women wellness and women wellness health fair. And so the next year we did it again, and a lot of men were bringing their wives. And actually that first year, one lady who helped us at the health department, she was diagnosed because of our health fair. And so that was our goal, is to make sure women had access to health services that they can afford. And we provide all the services free through this health fair, and educate women through this health fair. And, you know, I'm convinced that early detection will save a woman's life. And so I began, every year it just became more of a passion for me, because every time we do the health fair, we save somebody's life. And that's so important. And I didn't realize, I learned then how many women were underserved during my journey. And I learned that through Dr. Phillips and the research that has been done, especially in small towns where they don't have hospitals, they don't have doctors that can provide these services. They have to drive 40 and 50 miles away to get to a doctor. But Dr. Phillips has raised the money to purchase and design a mobile mammogram. And I just think it's so amazing. And I just, pray that other women are blessed as I am, because I just happen to have health care, and I was able to get my mammograms. I had a baby 2 years prior to that, so in between I didn't have a mammogram. But so my baby might have been 3 years old, and I had my mammogram. I wasn't nursing anymore, and I felt it safe to get my mammogram. And when I got it, there was something suspicious there. Now, I've had that before, but when I went back for my second follow-up, they said I was okay. But this time they said, I think you need to go see, your primary care physician. And I knew something was wrong when my primary care physician called me before I made it home from the hospital, from having my second mammogram. And that was the beginning of my journey. At first you think you can't get through it. Why me? And, after going through it, learning about other women, journeys, and what I've done, I realized that I was chosen by God. And I decided to answer his call to minister and share my story and help support other women so that they can live. And, it took me a minute, although I was, doing the health fair and all of that, but I never told people I was a breast cancer survivor. And when people look at me, they think I'm this person that just so strong.
Whenever you guys
okay, and that I can do anything. I ran for an election, won it for the first time, and nobody knew. Nobody knew I had gone through that. And I might slip every now and then, or they may see me at a breast cancer event, and then they still never knew. But when people find out, they're just shocked, because they say, well, I didn't know. Well, I continue to try to live my life every day where people wouldn't know. Not that I was ashamed, I just didn't want people to know I had breast cancer. But now, I want everybody to know, because I want everybody to know how blessed I am and what God has done for me. And that is to give me a second chance on life, And so with this second chance, I want to extend this blessing to other women and to other people in the community, and to hope I can educate and save other lives, and for us to really collaborate in the community so that we can teach our children and our students how to be good advocates for breast cancer.